Hello my dear students, I hope you are doing well. I am Associate Professor of Department of Human Anatomy and Medical Terminology of Azerbaijan Medical University, Anar Abdullayev, and the topic of our today's lecture is Topographic Anatomy of Neck, anatomical foundation of incisions which are performed for detection of organs, vessels and the nerves of neck, topography of the soft tissues of the neck, triangles of the neck, their topography, contents and the clinical anatomy, topographic anatomy of the nuchal area. And I prepared the special plan for our explanation. First of all, I will explain you the topographic anatomy of the neck. Then we'll talk about incisions which are performed for detection of organs, vessels and the nerves of this very important area. Then I'll explain the topography of the soft tissues of the neck, triangles of the neck, their topography, and finally we will talk about the topographic anatomy of the nuchal area. First of all, I want to say what is the neck? It is the part of the body which doesn't have the very great sizes, but it's important because it connects the head with the trunk. And in this picture, if you are looking at these pictures with attention, we prepare the boundaries of the neck. The superior boundary of the neck originates at the region of the mental protuberance. Then it passes along the inferior border of the mandible and reach to the mandibular angle. From here, from the angulus mandibulae, the special imaginary line connects the angulus mandibulae and the tip of the mastoid process. Then it passes through the nuchal lines till the external occipital protuberance. Inferior border of the neck. It begins at the region of the sternum, or the upper border of the manubrium sterni, and passes along the upper border of the both clavicle. Of course, in this picture you are looking at the one side, at the left side, and also this border is the rounded and goes till the acromion process of the scapula. From here it will pass till the spinous process of the seventh cervical vertebrae. And the posterior region of the neck also is called the nuchal area, or the just simply saying the regio colli posterior. You know from the course of the anatomy that due to the erect position of the human body, muscles of the neck, we must consider the muscles of the neck only anterior part of the neck, because the back muscles they occupy the also posterior part of the neck. But topographical, from the topographic point of the view, we have to consider these muscles also which are belong to the neck region, because we are talking about the regions. And in this picture you are looking like the sternocleidomastoid muscle, the very important muscle of this region, separates the neck into the anterior and the posterior triangles. They are also called the medial and the lateral triangles of the neck. I'll explain these triangles slightly later. And the regions, which are, we are very interested in the regions because the projection of the main nerves, nerve trunks, the great nerve trunks, vessels, all of them they are projected to the skin of the neck as in any other area. And we have to know first of all these regions, then the projection of the many important bony landmarks, and not only bony landmarks. As you know, in the neck region we have the important cartilaginous structure, the larynx. Also it has some projections to here, and these points, these landmarks are very important in several actions. For example, during the injections, for the stop bleeding, and etc. All of them are important, but for the simplification of our conversation today, I have to begin from the regions. You are looking at the submandibular region, also the submandibular triangle, corresponds to this region. Between two submandibular triangles, we will have here the submental triangle, and anterior region of the neck is very important because the esophagus, also trachea, of course, they are beginning part, also larynx with the prominence of the larynx or Adam's apple, especially in men, all of them are projected in this region. To lateral from this region, we will get the carotid triangle, trigonum caroticum, and the region is very important here because the common carotid artery and the internal jugular vein and the vagus nerve together, they form the main important vascular nervous, the fascicle or the bundle of the neck. All of them pass in this triangle. Sternocleidomastoid muscle, this one, also separates, like I have explained previously, separates the anterior and the posterior part of the neck. The lateral cervical region, here's our greater supraclavicular fossa, the subclavian artery, subclavian vein, of course subclavian artery behind and the vein, all of them are projected here, and the posterior cervical region, or the simply saying the nuchal region. This is the for the brief information about these regions. And dissection lines of the neck also very important, because during your future surgical practice you have to know these lines. First of all, it's by midline, which passes through the mental protuberance till the jugular notch for separation of the neck into two halves. And the next incision must be provided along the superior border of both clavicles till the acromion or the acromioclavicular joint. And in this picture you are looking, of course, at the projection of main structures, main body structures to the anterior surface of the neck. You are looking at the hyoid bone. Yes, it's the very remarkable structure, a very important structure. It acts like the important anchor for many muscles, suprahyoid muscles and infrahyoid muscles, and the location of this bone by development, I explained you during our previous lectures that it also is belong to the bones of the skull, but it locates in the neck region. And in these pictures you are looking at the many important bony and the muscular projections of the neck region, like sternocleidomastoid muscle, and here's the sternal head of this muscle, Adam's apple or the prominentia laryngea, which is more convex in men, of course, and this convexity we can observe beginning from the 10 to 12 years. It's the finally gets the it's the final picture, final figure. And the sternocleidomastoid muscle, and also you are looking at the trapezius muscle with the main boundary between the anterior and the posterior parts of the neck. And the skeletopy of important structures like the hyoid bone. See, here's the, it means the cervical, third cervical vertebrae, great with greater horns of the hyoid bone and the lesser horns of the hyoid bone. Mainly body of the hyoid bone, it's projected at the level of the C3, I mean the third cervical vertebrae. Also our thyroid cartilage, here's the C4 fourth cervical vertebrae, also very important point, because the bifurcation of the common carotid artery happens here, the dividing into two main branches, the external and internal carotid artery also are happened here, and the cricoid cartilage and the thyroid gland, the very important gland of endocrine system, also is projected onto the anterior region of the neck. And in this figure you are looking at again at the anterior and the posterior triangles of the neck. very important anatomical keys. Here's the thyroid notch with the thyrohyoid ligament is here. This ligament very important because the side by side from this ligament we will get the membrane between the thyroid cartilage and the hyoid bone, and this membrane is penetrated by the superior laryngeal nerve from the vagus nerve. As a branch of the vagus nerve, also superior laryngeal artery. The second here is means the laryngeal prominence. Also 3, it's the median cricothyroid ligament, the ligament which connects here, connects the our cricoid cartilage. This one looks like the ring, and also thyroid cartilage between the very important the cricothyroid ligament. Why it's so important? Because this ligament is form the connection between the thyroid cartilage and the cricoid cartilage, and also the cricoid cartilage is established the base of the larynx. Very important establishment, the base of the our larynx, and the thyroid cartilage, also arytenoid cartilage, both connect with the cricoid cartilage and they form the movable joints. And also you are looking at here at isthmus of the thyroid gland. It's projected at the level of the second, third tracheal semirynx, and here the greater supraclavicular fossa, or the is also we will call them the trigonum omoclaviculare, the sternal head of the sternocleidomastoid muscle, and the common carotid artery. Common carotid artery here is explained like under the number of the 8. 9, it's the lesser supraclavicular fossa overlying the internal jugular vein, because the lesser supraclavicular fossa is it has some difficulties for observation. We can observe this fossa only in very thin persons, because the little amount of the fat can fill this fossa. It locates between the two heads, sternal head and the clavicular head of the sternocleidomastoid muscle. Also course of the brachial plexus is here, is 11. 13 is the trapezius, and the 12, of course, this is a projection of the subclavian artery. Only this brief information, only this maybe very simple picture explains the importance, great importance of the vascular and the nervous structures, also viscera of this region. They have the great importance. They have the great importance for life. And of course, topographic anatomy of cervical region begins from the definition. On the right side, you are looking again at the limiting boundaries between the head and the neck, and between the chest and the neck. And in this picture, you are looking the very identifiable the structures like the jugular notch. Here's the superior border of the clavicles and the trapezius muscle. Here is the mental protuberance with the inferior border of the mandible, base of the mandible, and past the imaginary line from the angulus mandibulae and the tip of mastoid process. Of course, if we want to explain the soft tissues of the neck and the triangles of the neck and the vessels and the nerves of this region, we have to begin from the bony framework of this region. Of course, the bony framework of the neck region is formed by the mainly 7 cervical vertebrae. 7 cervical vertebrae. From first, it has the special name atlas. The atlas connect with the occipital bone, and forms here the combined joints, the right and left atlanto-occipital joints, and to the second, third, fourth, fifth, sixth, and the 7th cervical vertebrae. They form together the bony framework of the neck. Of course, you know the anatomical definitions of these structures, because We can just little repeating we can provide for the for remind the several structures of these bones. For example, they have the very small body. They are the foramina of these vertebrae are triangular in shape, and the transverse processes of these vertebrae is divided into two tubercles, anterior tubercle and the posterior tubercle. It means on the posterior, between the posterior and anterior tubercles of the transverse process, we'll get the opening, foramen transversarium. Foramen transversarium is very important. Foramen transversarium, if you want it's the visit card of the cervical vertebrae, because the no thoracic and the lumbar vertebrae have these foramina. And in this point of view, we also have to talk about its clinical importance. For example, 6 cervical vertebra, its anterior tubercle is called the tuberculum caroticum, carotid tubercle, because it is very close contact with the common carotid artery, and during the bleeding of this artery, also for the stop bleeding, we can press the bleeding point to these tubercles. And posteriorly it form the special row of these bodies, and they connect by the discus intervertebrale. Here's the discus intervertebrale. It's very important moment. And if you are looking at their joints between the superior and inferior articular processes, there are articulatio processus articularis, or the zygoapophyseal joint. Zygoapophyseal joint, here is their capsule, and several words about their ligaments. We are interested in this ligament, especially the ligamentum nuchae, which passes through the spinous process of the last cervical vertebrae till the external occipital protuberance. This is the ligamentum nuchae. Ligamentum nuchae is important in several animals. In human, it develops very weakly, but it also has the same name with the name of the region. You can remind the name of this ligament. Ligamentum nuchae corresponds to the ligamentum supraspinale, which you find on the other vertebrae. And of course, the muscular coat of the neck region. You know, the muscles of this region is divided into the superficial and deep group. You are looking at the most superficial muscles of this region, such as the platysma. Looks like the muscles of the emotion, muscles of the facial expression, because like the muscles of the facial expression, it is located under the skin, and between the muscles of the facial expression and the platysma, there is the great genetic relationship, because like the muscle of facial expression, our platysma developed from the second visceral arch, of course being innervated by the facial nerve. And you are looking on the preparation at this muscle. It locates just under the skin, and the next muscle of the superficial group, the sternocleidomastoid muscle. The sternocleidomastoid muscle with 2 heads. It has the 2 heads, the sternal head or the medial head, and the lateral head or the clavicular head. Between them, the fossa supraclavicularis minor. About it I have told before. And if you are looking from the deep to the superficial group, the scalene muscle. Scalenus anterior, middle, and the posterior muscle, they are very important because they form the lateral group of the lateral division of deep group muscles of the neck. Anterior scalenus and the middle scalenus muscles, they both attach to the first rib. and between them there is the space, interscalenic space. Interscalenic space has great importance, because our subclavian artery and the brachial nervous plexus, they locates initially, each one locates here, both of them locate in this space. The scalenes and the sternocleidomastoid act together in several muscular actions, such as for example, lateral neck flexion. The sternocleidomastoid and the anterior scalene act together in the neck flexion. You are looking at this picture. And of course, the fascia of the neck, the very important moment. Just I'll give you the common brief information about it, and slightly later we will talk about the classification of the cervical fascia according to new investigation. By the standard anatomical classification, the fascia of the neck are divided into the superficial, then they are the pretracheal lamina or pretracheal plate, and the prevertebral plate, of course. But prevertebral plate or the prevertebral lamina, it is the most deep fascia of the cervical region. Pretracheal layer, it is considered like the proper fascia of the neck, and it's also divided into superficial and the deep groups. Please don't confuse superficial plate of this proper fascia and the superficial fascia of the neck. For example, the superficial fascia, just superficial fascia, it covers the neck from all sides, and it doesn't have the very great clinical or the anatomical importance. And we will pass to the pretracheal layer. Pretracheal layer, I have told you, it is the proper fascia of the neck, and it has two layers, superficial and the deep group. Superficial layer of pretracheal fascia divides into the two layers, and they surround the sternocleidomastoid muscle and also trapezius muscle. Deep part of the proper fascia mainly encloses the infrahyoid muscles. I mean the omohyoid muscle, also the sternohyoid muscle, sternothyroid muscle, and the thyroid muscle. And it attached to the omohyoid muscle at each side, and it helps during the tension for the venous flow, venous circulation in the cervical veins, especially the superficial and the deep veins. And what about the viscera, about the internal organs of these regions, such as the larynx, such as the trachea, upper part of the esophagus, thyroid gland? All of them also enclosed by the deep plate of the cervical fascia, but this plate has the special name, fascia endocervicalis. In this table also it's explained like the visceral fascia encloses the larynx, trachea, pharynx, esophagus, and the thyroid gland, of course. Prevertebral layer or the prevertebral plate surrounds the cervical vertebral column and the muscles associated with this. Also, we have to talk about the proper fascia, which form the special sheath for the nervovascular bundle of the neck. I mean the carotid artery, internal jugular vein, and the vagus nerve. All of them are enclosed within the special vagina, within the special sheath. And this is called the carotid vagina or the carotid sheath. And again, you are looking at this picture, first of all, at these muscles, suprahyoid muscles of the neck and the infrahyoid muscles of the neck. Just for repeating, you know the suprahyoid muscles of the neck are the followings, like the stylohyoid, biventer or digastric muscle, mylohyoid, and the geniohyoid muscles. They are very important, especially very interesting moment, especially during the opening of the mouth, this action, or the movement of the mandible to downward. Why? Because as you know, the hyoid bone, it attached to the other skeletal points of our body by the muscles. This type of connection is known as synsarcosis. Sarcos translates as a meat, and it means the connection of the bone to the other bone by the muscle. It's suspended within the muscles, and when this bone is fixed, for example, hyoid bone is fixed, and the other muscles, they originate from the mandible and attach to the hyoid, but hyoid is fixed. Which action then will happen? Of course, the opening of the mouth. And it happens just only during the fixation of the hyoid bone. You are looking at the hyoid bone. As I have explained you, it's the main one of the main important bone structures of the neck region, and in this colorful, very great, interesting with the several colors, the picture, you can look at the for beginning. Of course, I'll explain the triangles the slide later. You can look at the triangles of the neck. For example, in this picture, not with the so great and very interesting colors, but the very strictly explains the location of triangles. Main triangle, submandibular triangle, which is located between the base of the mandible and the two venters of digastric muscle. Submandibular triangle, yes. Submental triangle, it's unpaired, very interesting, because it's formed at the midline. It's mainly formed at the midline between the two anterior venters of digastric muscle and the hyoid bone. This is our carotid triangle, the lesser supraclavicular fossa between the two heads, between the sternal head and the clavicular head of the sternocleidomastoid muscle. And again, after this explanation, you can look at we can continue the conversation about the cervical fascia. Why? Because our proper fascia in relation to the hyoid bone is divided into the two parts, the suprahyoid portion and infrahyoid portion. And when the infrahyoid portion of this plate goes downward, anterior plate of this fascia attached to the anterior surface of the sternum, posterior attached to the posterior, and we will get the special space, spatium suprasternale, spatium intraaponeuroticum suprasternale, with the special arch which connect two anterior jugular veins. Anterior jugular vein, they are formed from the small subcutaneous vein of this regio. And please look at the carotid vagina. It's also derivative of the cervical fascia, and structures which are enclosed here, you know, these are the internal jugular vein, common carotid artery, and the vagus nerve. Here is the brachial plexus and the subclavian artery. And here is our venous plexus around the thyroid gland, because the thyroid gland, like the endocrine gland, it is surrounded by many vascular structures, many vessels. And if we are talking about the skin of this region, we are interested in the innervation of the skin, because from the topographical point of view, these nerves also have the great importance. First of all, it's the cervical plexus. What is the cervical plexus? It's our first plexus, which is formed by the anterior branch of the upper three, maybe upper four cervical nerves, and the origination of this plexus is located at the level of the upper cervical vertebrae, and the branch of the cervical plexus is are divided into these branches are divided into the communicating cutaneous branch, muscular branch, and of course the mixed branch. About the mixed branch, and the very important sample of this branch is the phrenic nerve. We will talk during our next lecture because it's innervation of the diaphragm. Mainly it acts within the thoracic cavity, and in this picture you are looking at the skinny branch or the cutaneous branch of the cervical plexus, like the nervus auricularis magnus in this picture, nervus transversus colli, and the nervus supraclavicularis. These three nerves begins mainly from the same point. It's the very close to the posterior border of the sternocleidomastoid muscle, which you have to know. Of course, you have to indicate it, and you will based during the providing some injections for the many actions for the many purposes, beginning from the incisions at this regio, then the ending at the, for example, plastic or the aesthetic operations of the neck. And the fourth nerve, or fourth skinny nerve, fourth cutaneous nerve of the cervical plexus, it's our nervus occipitalis minor, lesser occipital nerve. And again, you are looking at the suprasternal regio, and you are looking at the internal jugular vein and the common carotid artery and the vagus nerve. Of course, in this picture, the internal jugular vein and common carotid artery, they have been cutted, and you are looking at the space between them, and you are looking at the middle cervical ganglion. I told you about the 6 cervical vertebrae, and it's the great importance in the clinical practice. I told about the anterior tubercle of this the vertebra, but also you have to know the middle cervical ganglion, which is the sympathetic, and it takes place with the other cervical and the upper thoracic ganglia in sympathetic innervation of the heart. This ganglion is situated at the level of the 6 cervical vertebrae, and here is the veins of this regio, jugular, anterior jugular vein, and they form the arch which is located here, just the upper than the sternum, the manubrium of the sternum, upper plate, and the spatium aponeuroticum is formed here between 2 plates of the cervical fascia of its infrahyoid part. And in this picture, in this sagittal view, you can look at the auricular nerve, greater auricular nerve, nervus auricularis magnus, lesser occipital nerve, transverse cervical nerve, and the supraclavicular nerves, which are also, all of them, as I have explained, all of them are the cutaneous nerves. And the veins of the cervical regio, we continue our conversation about it. External jugular vein. External jugular vein also is very important, and here is its projection onto the skin. External jugular vein corresponds to the posterior branch, of the external carotid artery, and it begins by the veins which accompany the posterior branch of the external carotid artery. External jugular vein, again, in this picture you are looking at the fascia of the sternocleidomastoid muscle. As I've told you, this fascia is formed by the superficial layer of the pretracheal plate of the cervical fascia, or the pretracheal plate also is considered like the proper fascia of the neck. You are looking again the posterior side of the neck. Here's the nuchal regio. Of course, after removing the skinny and the fatty tissue, you are looking at the pharyngeal venous plexus, which is mainly formed at the fornix, pharynx, and is good developed at the posterior wall of the pharynx. all of them beginning from the pharynx, then the facial veins, the lingual veins, they are paired because I'm calling them the veins. All of them are the roots of the internal jugular vein. You are looking at this bundle, main neurovascular bundle of the neck or the cervical region from the posterior side. Internal jugular vein here with the common carotid artery and the vagus nerve on posterior side, and you are looking at the muscles of the pharynx. Of course, the pharynx is one of the unique organs of our body because it has the dual function. It belongs to the digestive system and also it belongs to the respiratory system at the same time. And the location of the pharynx, of course, we are interested during our conversation about the topography of the neck, about the structure of the pharynx, because the pharynx totally is correspondent to the neck region. It is located between the base of the skull and it goes inferiorly and at the level of the last two cervical vertebrae, between the 6th and the 7th cervical vertebrae. It passes to the, it continues to the esophagus. It continues to esophagus, and please look at the very close relation to these organs, to beginning of the esophagus and the ending point of the pharynx with the thyroid glands and with the parathyroid gland. You have to know sometimes the parotid gland, they are enclosed into the capsule of the thyroid gland. Very interesting moment, because during the operation, resection for example on the thyroid gland, you can damage, you can injure and they remove the part or the totally parathyroid gland, and it's a very dangerous moment, very dangerous moment. You have to look at it, mainly the parathyroid glands. Yes, of course they are variable by number. Yes, mainly in standard anatomical explanation we are talking that we have the 4 or the 2 pair parathyroid gland, but they can be between the 1 till the 7, and they are located around the main vessels which have entered into the mass of the thyroid gland. You have to be a very important moment. You have to be with great attention for the differentiation of the parathyroid and the thyroid during the resection of the thyroid gland. And about the new investigation about on the cervical region, in this picture you are looking the fascial-like structures around the sternocleidomastoid muscle, which is covered by it. Asterisk indicates portion of the fascia medial to the, here's the sternocleidomastoid, for example, the 3 pictures like the continuation each other. This asterisk, they indicate a portion of the fascia medial to SCM, this is the sternocleidomastoid muscle. Of course, the platysma was reflected inferiorly and slightly posteriorly. The fascia-like structure deep to platysma was transversely sectioned, and it's very important moment. The sectioned fascia was reflected also inferiorly. Arrows point the cutting edge along the medial border of the CSM, sternocleidomastoid muscle, which demarcates a rough medial and a smooth lateral surface of sternocleidomastoid. And the sternocleidomastoid muscle here was cut and reflected inferiorly. You are looking at the OM, it means the omohyoid muscle here. And in this picture, the fascia of the sternocleidomastoid muscle, we are interested on them picture A, and the red and blue latex asterisk was injected into the right and the left sternocleidomastoid muscle respectively. The left sternocleidomastoid muscle fascia was opened to reveal that the injected latex was limited within one head of the muscle. Here's the asterisk here, by the intermuscular septa. It's held, this septa, by forceps. Yes, and it's the very delicate preparation of this region. And the sternocleidomastoid muscle was cut and reflected. Here's the inferiorly. The arrow indicate the spread of the latex around the along the intramuscular septum is here. Yeah. Light blue latex was injected into the fascia deep to the sternocleidomastoid muscle and was limited to around the strap muscles. Here's the double asterisk. Firstly here, and the next is to here. And of course, we are talking about the neck, we are talking about the muscles, skin, their innervation, vascularization of this region. What about the fat? Fat pad is in between the skin and the platysma here. You are looking at it. Depending on the body mass index and of course the sex, the subcutaneous tissue layer might contain the quite a thick layer. It depends on, of course. This layer can be removed from the platysma underneath easily without removing the fascia of the platysma because there is the soft connective tissue located in between. Of course, it demands some delicate operation, some delicate preparation. The thickness of the fat pad regularly is the submental region well developed here. And of course, this section of the left neck region remark the fat tissue underneath the fascia in the lateral cervical triangle here. You are looking at the fascia cervicalis superficialis. This fascia is the superficial body fascia which continues either cranially into the fascia parotidoma or caudally into the fascia thoracica superficialis, which covers the greater pectoral muscle, musculus pectoralis major. This fascia is a strong and especially in the ventral part of the neck well-developed tissue, whereas the fascia cannot be well dissected without damage in the lateral cervical triangle or posterior cervical triangle. This section of the deep plate of the pretracheal fascia, as you know, this fascia is is considered as the proper fascia of the neck, and mainly it's the deep layer in the relation to the hyoid bone is divided into the suprahyoid and the infrahyoid part. You are looking at the triangles, the carotid triangle, it between the posterior part or posterior belly of the digastric muscle, sternocleidomastoid muscle, and the superior belly of the omohyoid muscle. And again, looking at the whole neck, which is covered by the skin, and here the skin, if we cut it, we will get first of all the platysma. And with the cervical branch of the fascial nerve, also the transverse branch or the transverse cutaneous nerve of the neck. Next layer, of course, we are looking at the fascial layers, fascial vagina of the cervical region. You are looking again the sternocleidomastoid muscle and the middle constrictor of the pharynx. We are interested, and here is the inferior constrictor, middle constrictor, inferior constrictor. Look at please the cerohyoid membrane. I have told you the two main vascular nervous structures, they penetrate them. I mean the superior laryngeal artery and the superior laryngeal nerve. Look at please the common carotid artery and dividing into the internal and external carotid artery with the main bodies. It is the carotid body, carotid sinus, and the carotid body. They have the many reflexogenic zone, which you know from the course of the anatomy. And here you are looking at their topographic relation to the muscles and the other structures of this region. Superior thyroid artery as a first branch of the external carotid artery, lingual artery, of course the facial artery, 6, 7, and 8. 9th is the ascending pharyngeal artery, the medial branch of this artery, the seen artery, the not well developed as a, for example, lingual or facial artery. And you are looking at the veins of the carotid triangle. The internal jugular vein first is the common facial vein, which also open here, the pharyngeal veins from pharyngeal plexus, and the lingual vein. I have told you all of them form the make the special roots of the our internal jugular vein. And about the nerves, the vagus nerve, which establish like the part of the vascular nervous bundle of the neck, and with its branch, the superior laryngeal branch, external laryngeal nerve, which innervates just cricothyroid muscle, and the other part of this nerve enters from the thyroid membrane into the cavity of the larynx and innervates the mainly our laryngeal cavity till the glottis, till the voice cleft. And lymph nodes of this region. These lymph nodes are very important because they receive the lymph not only from the neck, they also receive the lymph from the head, and these nodes are located around the jugular vein because they are called the internal jugular lymph nodes, or just the jugular lymph node, and they continues like and form the jugular trunk, jugular lymph trunk, right and left ones. And from these sections which were provided at the level of the cervical vertebrae, you can look at the spaces: pretracheal, retropharyngeal between the deep plate of the pharyngeal fascia. It's formed, and the pharynx. It's very important because it's filled by the lymph nodes, and also loose connective tissue. And the spread of the infection, spread of the inflammation is so dangerous in this space. Also these cuttings, and at the several layers, you are looking at the trachea, and behind the trachea is esophagus, mainly in the dolichomorphic persons and the brachiomorphic persons. If we want to compare between them, the recurrent laryngeal nerve left one, the ascents between the trachea and the larynx, and you are looking at the pretracheal fascia, so proper fascia. And for the muscles, the infrahyoid group muscles like the sternohyoid, sternothyroid muscle, omohyoid, all of them are enclosed by the pretracheal fascia. I have told about it. And the thyroid gland also is enclosed by the endocervical plate or endocervical fascia. And the esophagus, in this region, in the at the inferior part of the neck, it is located in the superior mediastinum, but then in thoracic cage it is changed its position and goes to the posterior mediastinum, about which we will talk during my next lecture. And again, please, carotid sheath, which is formed by the internal jugular, it is filled by the internal jugular vein, common carotid artery, and the vagus nerve. And prevertebral fascia, please. It's the deepest of the along the all fascia of the cervical region. Retropharyngeal space, again you are looking at the retropharyngeal space, danger space, because the inferiorly it goes inferiorly, and the retropharyngeal space, which is limited by the prevertebral plate, goes inferiorly and passes to the fascia endothoracic fascia. Visceral space, which is formed for the organs of the cervical region, like the thyroid gland, like the parothyroid gland, but I have explained that maybe parothyroid gland totally locates within the mass of the thyroid gland, and it makes this position, this topographical position, so dangerous. The carotid space, again you are looking at the carotid space with the common carotid artery, with the internal jugular vein, with the vagus nerve. And this position also can explain their relation to each other. And if you want to understand their main source, maybe you forget it, the common carotid artery, both at the left side it originates from the aortic arch, and from right side it originates from the brachiocephalic trunk. In this picture you are looking from the back, because maybe you can confuse them. It's from the right to the left, but you are looking from the posterior side. In this picture you are looking at the lobe of the isthmus mainly, and the part of the left lobe of thyroid gland has been cutted for the observation of the second, third tracheal cartilage, which are under the isthmus of the thyroid gland, and others till the fourth, fifth, sixth, again they are under the lobes of the thyroid gland. And please, again, you are looking fascial structures and the veins of this region. Scalenus muscles. Again, I want to note several moments about the scalenus anterior muscle. It is key muscle of the root of the neck. You are future surgeons, you have to know it. It's deeply placed and descends vertically from the vertebral column to first rib. Origination from the third to sixth cervical vertebrae, insertion to the first rib. Action, as I told you, they elevates the first rib during of course the bilateral contraction, laterally flexes and rotates the cervical vertebrae. Nerve supply, of course, by the cervical nerves, and important relations. We are interested in important relations. Scalenus anterior. On the anterior surface of the scalenus anterior muscle is our phrenicus nerve, nervus phrenicus. Anterior, the carotid arteries, vagus nerve, internal jugular vein, deep cervical lymph nodes, transverse cervical, and the suprascapular arteries. That's the topographical relation of this structure. Prevertebral layer of the deep cervical fascia, blind phrenic nerve to muscle. Posteriorly, the pleura, origin of the brachial plexus, second part of the subclavian artery, and the scalenus medius. Medially, it's the vertebral artery and the vein of the same name, also sympathetic tract. Left side medial border is related to the thoracic duct. Lateral position of this muscle, the cervical plexus, roots of the brachial plexus, and the third part of the subclavian artery. Again, you are looking at the common carotid artery, its origination at the right side from the brachiocephalic trunk, at the left side from the aortic arch, and subclavian arteries. Subclavian artery on both sides arch upwards out of the thorax to enter root of the neck. Right subclavian artery begins posterior to sternoclavicular joint as one of two terminal branches of the brachiocephalic trunk. You know it. Each arch superiorly and laterally to pass anterior to the cervical pleural and posterior to anterior scalene muscle. Continuing laterally across the first rib, it becomes the axillary artery. Left subclavian artery begins in thorax as a direct branch of aortic arch. Lying posterior to the left common carotid artery and lateral to trachea, it ascends and arches laterally, passing anterior to cervical pleura and the posterior to anterior scalene muscle. Continuing laterally across the first rib, it becomes the axillary artery. You are looking at the submandibular triangle and the very important structures of this regio. I have told that this triangle is formed between the two venters, two bellies of the gastric muscle and the body of the mandible. You are looking beginning from the occipital artery, the parotid gland, the arteria facialis, facial artery when it turns around the mesenteric muscle, lingual nerve, which is very important nerve for innervation of anterior two-thirds sensory innervation of the anterior two-thirds, and the main structure which fills the submandibular triangle, the submandibular gland, ductus submandibularis, its duct, and also arteria profunda linguae, deep lingual artery, with the arteria sublingualis, also finally terminal branch of arteria lingualis. 9 and 18 here explains the hypoglossal nerve, because the hypoglossal nerve forms the superior limit of the Pirogov's triangle. Pirogov's triangle, which is very important, it locates at the deep part of submandibular triangle, and mainly this triangle and the lingual artery which passes here is important during the stop of bleeding from lingual artery, especially during the operation on the tongue. And the musculus digastricus, arteria thyroidea superior, which I have showed before, all of them are these structures are very close related to the submandibular triangle. It explains the importance of this triangle. And the next moment, the structures of the carotid triangle, but I have showed these structures to you. I don't want to repeat it. You are looking at the main structures like the superficial veins of the neck, mylohyoid muscle which forms the diaphragm of the oral cavity, and from this point of view you are looking at the relation of two triangles, the carotid triangle and the submandibular triangle. And again, you are looking at the medial or anterior triangle of the neck and the posterior or the lateral triangle of the neck. In this picture, you are looking from the reflected several muscles. You are looking at the omohyoid muscle, which forms some boundaries for the medial or anterior triangle. It forms the limits of the carotid and the omotracheal triangles. And the lateral region of the neck, of course, you are looking at the lateral region of the neck. The main blood vessels and nerve trunks pass here. I mean, of course, the subclavian artery, and the brachial nervous plexus. Brachial plexus is formed by the lower 4 cervical nerves, also by the first thoracic nerve, and initially it locates in the interscalenic space, but then it formed the 3 main trunks and it passes from the superior openings of the axillary cavity into the axillary fossa. And the trigonium omotracheale, in this picture you are looking at this triangle. Topography of the larynx. Yes, we have explained the main structures around the larynx. You are looking at the larynx, you have to know there is some sex difference between the location of the larynx in men and women, because in men it is located between the C5, C7. The upper border of larynx is located at the upper border of the 5th cervical, and the lower border is located at the lower border of the 7th cervical vertebra. In women, the upper border of the larynx is located at the level of the inferior border of 4th cervical, and the inferior border at the superior margin of the 7th cervical vertebra. And the general features of the larynx, in this picture you are looking at them. The larynx has several functions, except also in addition to respiration, it's the protective function, and the voice production. And you are looking again at the fixation of the larynx superiorly to the hyoid bone and inferiorly to the cricoid cartilage. And there are vessels and nerves, which I have explained before. You are looking again at the penetrating point of the structures which enters into the laryngeal cavities, this branch of the superior laryngeal artery, superior laryngeal nerve, and the recurrent laryngeal nerve, which ascends at the left side, turns around the aortic arch. At the right side, it turns around the right subclavian artery and ascends to the larynx. Of course, we are interested in the approach to the larynx to trachea. In mid-sagittal section, left lateral U, an acute edematous obstruction of the larynx, for example, due to an allergic reaction, pose an acute risk of asphyxiation. The following surgical approaches are available for creating an emergency airway. Divisions of the median cricothyroid ligament, it's called the cricothyrotomy. Incision of the trachea, tracheotomy, at the level just below the cricoid cartilage, high, and or just superior to the jugular notch, low tracheostomies. And anatomical relationship between the superior thyroid artery and external branch of the superior laryngeal nerve, which I have explained it before, and several words about the inferior thyroid arteries. They are a branch of the thyrocervical trunk, inferior thyroid artery, a branch of the thyrocervical trunk arising from the subclavian arteries, run superomedially posterior to the carotid sheath to reach the posterior aspect of the gland, supply the posterior inferior aspect, including the inferior poles of the thyroid gland. The right and left superior and inferior thyroid artery form the anastomosis, because it's the main rule about the endocrine organs. They have the very rich vascularization, and also you can look at the lymph nodes, which I also have explained before. Veins of these glands, there are three pairs veins of the thyroid veins. Superior, middle, and inferior form the thyroid plexus of veins on the anterior surface of the thyroid gland and anterior to the trachea. Superior thyroid veins accompany the superior thyroid arteries. Middle thyroid veins do not accompany but run essentially parallel courses with the inferior thyroid arteries, and inferior thyroid veins accompany the thyroid artery, of course, if the artery is present. And I have told you about the lymph drainage of the neck region. You are looking at them mainly by the cervical fascia. They are divided into superficial and the deep group. Deep group also has the two subdivisions. Anterior, they are located pretracheal, prelaryngeal, and the lateral or the jugular lymph node. Presence of metastasis in lymphatic nodes of the neck can be first sign of the thyroid carcinoma. Thyroid lymphatic vessels communicate with the first level prelaryngeal, pretracheal, and the paratracheal lymph nodes. Second level superior deep cervical node from the prelaryngeal nodes, and inferior deep cervical nodes from the pretracheal and the paratracheal nodes. Some lymphatic vessel may drain into the brachiolymphatic nodes or directly to the thoracic duct. My dear students, thank you for attention. If you will have any question, you can contact with me. Thank you for attention. Goodbye.